everybody. My name is Michelle Jones, and I am so excited to have you with us today because today we get to talk about heart disease. And I am really pleased to welcome Dr. Monica Aggarwal. And welcome. I'm so glad that you're here with us today. And
so good to be here.
Also, Amy. Amy typically does our behind the scenes issues, and so she's going to talk to us a little bit about our technology today before we get started.
Hi, everybody. Thank you for joining us today. We are extremely excited, as Michelle said, about this workshop today and an appropriate time for February Heart Health Month. So I see many of you have already found the chat. And so that is the first thing. Find the chat section, say hello, tell us where you're joining us from. I love that we can do this on a platform that allows all of us from all over the world really to join in. So Arizona, Omaha, Pittsburgh, Ohio, Missouri. I mean, we're all over. So it's wonderful to be able to come together for such a wonderful, great topic for our health. If, this is technology, it happens, things happen. So if you have issues hearing us or seeing us, one of the best things you can do is try refreshing your connection. And if you're still having issues, sometimes changing to a different browser can help. So we have found that we really like the Chrome browser best. So that's one that you can try as well. If we happen to lose connection, give us a few seconds to jump back on, but at least all three of us are in 3 different states ourselves. So one of us will be here to say, oh, we'll be right back. So just, be patient with us. It is technology. But again, we are so glad that you're here. If you have questions, that chat area is where you're going to ask them. And then at the end of the time, we'll have a Q&A time to answer as many of those as we can. So welcome and thanks for being here.
Excellent. So before I introduce Dr. Monica, I did want to point out that Amy and I are wearing the same t-shirt today. We actually ordered them from Dr. Monica. Look how fun these are. So Amy will post the link, and if anybody else wants to get one, you can order your own super fun shirt as well. So Dr. Monica Aggarwal is an adjunct associate professor in the University of Florida's Division of Cardiovascular Medicine, where she conducts research on the impact of nutrition in chronic illness. She also serves as the chief medical officer of the nonprofit Four Roots Farm, which is looking at how to improve food quality to improve human health. Board certified in cardiology and 3 specialties of cardiology: echocardiography, nuclear cardiology, and advanced lipid management. She's a fellow of the American College of Cardiology. She's a member of the Nutrition Council working on nutrition policies for the nation. Her practice in Orlando, Florida is taking on new patients locally, plus telehealth medicine patients in 4 different states, in New York, California, Florida, and Maryland. And we are so very excited to have you with us today.
Thank you so much, Michelle and Amy. It's a pleasure to be here. You guys can hear me okay?
Yep.
Great. So I'm looking forward to talking to you about heart disease, but I titled the talk a little differently. I called it Inflammation and Chronic Illness because inflammation, I do think, is the key to so much of our illness, including cardiovascular disease. Thank you so much for the shout out about the shirts. So there's a little story there I'll tell you, is that my youngest daughter, who's 11, who is actually the one who my journey started with, created and designed those shirts, and she puts them together. And so it's her little business, and I'm completely supportive of it. She has to make the phone calls. She has to do all of the management of the tech and the organization of the design. And it's really fun to see her shine in that space. Okay. So I put on my social media here because a lot of people ask me that at the end. So there's my Instagram, but I also have Twitter and Facebook as well, if you prefer those venues, and my website, drmonicaagarwal.com, for people who have questions. And there's a copy of my book for your just awareness. Okay, here we go. Why am I here? So I am a preventive cardiologist. I've been a cardiologist for 15 years. I came into prevention maybe from birth because that's something that I've always focused on as even my family, and grew up that way. Went into cardiology as sort of a natural course for me to sort of really want to focus on heart disease. I became more interested in prevention. Starting back, I did an integrative fellowship where I was interested in learning how to use herbal therapies for prevention of heart disease and illness, and then went on to become board certified in cardiology and lipids so that I could manage complex lipid disease. I'm also a researcher, so I am on faculty at the University of Florida and the University of Central Florida, so two universities where I conduct research with medical students and residents. I'm finishing up a really interesting study on olive oil right now, which I can't tell you the details on because we're still analyzing the data, but that's really exciting. I'm also a mom. I have 3 kids. I told you my little Bambino is 11 now, so I no longer have babies, but I still call them my babies. I'm an athlete, so I'm a big time runner. I love to run. I do bar. I do yoga. And I used to do triathlons. I'm also, though, a patient. So about 11 years ago, after I had my 3rd child, I was diagnosed with inflammatory, poor prognostic, advanced rheumatoid arthritis. I went from being an avid runner to not being able to climb up the steps. I was put on multiple medications, which made my joints better, but then made my I had loads of side effects. I had symptoms of abdominal pain, metallic taste in my mouth. People used to admire me for having lost all my baby weight, which was just that I couldn't really eat. But you get through. I lost some of my hair. Sensitivity to the light, but you get through. You deal with the side effects of medications because you want to feel better. And I'm all about using medications in the risk-benefit ratio, but it's important to know that there are other options. How did I feel? So scared all the time. I was emotional. I was fragile. I didn't understand why things had happened to me, not in control. I was angry at my kid. And so I bring up these emotions because I want to remind people who are listening that you're not alone. It's hard to have illness. It's hard to get sick. And it's hard to feel bad. But also to tell you that some people on the outside look like they're completely fine and healthy, but everybody's got baggage and everybody has things that they carry. And I remind you that has happened to me as well. It's hard to be a patient. It's hard to be sick, and it's hard to have those feelings, but they're very real and important to acknowledge. So then I met a woman who was a nutrition specialist, and she came to one of my cardiology programs I was doing in Baltimore. And she said, hey, listen, I want to do some of your prevention with you. I was already doing sort of prevention from screenings. And she said, can I see some of your heart patients? And I wasn't super nice to her. And I said, look, I'm kind of busy. Nutrition's something we've got. We're good. And she goes, well, how about I do your nutrition profile? And I was like, what do you mean? Like, I'm healthy, And so the irony is that I didn't know really enough. I mean, I was vegetarian, but I was a bad vegetarian. And I didn't really understand what nutrition was. But, we as doctors sometimes think we know more than we do. You don't know anything about that, right? So I'm sure many of you have met doctors who talk big game. And unfortunately, sometimes we do that because we think we know a lot of things, and we do, but we don't know a lot about nutrition and lifestyle because it's not taught in medical school. And I'll go through that a little bit. And that's something I had to learn later in life. So when I talked to her and I said to her, well, look, she said, let me just do your profile. I had to make a decision about, what should I do? And when she started looking at my nutrition and lifestyle, she said, you know what, I think you're eating this wrong and that wrong. And I think you should change this. And I think it's going to help you in your inflammation and your arthritis. And so I thought, well, what do I have to lose? It's just a lifestyle change. That's not so bad. So I took the leap. And so I was already vegetarian, and I did an elimination diet. I added back a lot of different plant-based foods, which I'll talk to you about. I changed my sleep pattern. I started doing yoga. I slowed down from running and actually focused more on yoga. And I'll explain that to you as well. How did I feel? Within weeks of my change, I felt incredibly better. Within a year, it was like I didn't even have arthritis. This is me doing yoga with my little ones when they were a little younger. I went on to do my first triathlon after my diagnosis. So I would tell you that I certainly am not looking back. So why do I tell you this story? Well, I tell you this story not so you feel bad for me or that I've gone through illness, but to remind you that no one is perfect and life is imperfect and that all of us get sick, and that lifestyle. But there's so many things you can do. Lifestyle actually works. There's so many things you can do. You can change your diet, which can change your body. So I moved out of private practice and I moved back into academics. I wrote a book to honor my daughter because I kind of blamed her for my illness. And I'm not proud of that. It was something that I wrote that book to honor her, to show the world and to myself that there's so much you can do to heal your body. And it's not just quackery. It's not just foo-foo or life, other medicine, alternative medicine. This is what medicine is. The beginnings of medicine should start with prevention, with healing the body through lifestyle. So it led to a whole new career shift. Okay, so why did I get sick? Well, why does everyone get sick? It has the fundamental concept of inflammation. It's when your body's mad at you. So why is your body mad at you? Well, usually that's due to an imbalance in somewhere in your body. And then that triggers fire. That's why we named the title of our book, Body on Fire. So when you have fire in your body or inflammation, then it triggers parts of your body to get inflamed. And I'll explain that in more detail in a minute. But I want to highlight, though, that inflammation is actually the core, or that foundation pillar of all illnesses, including heart disease and diabetes and osteoarthritis and rheumatoid arthritis and irritable bowel. All these illnesses have that trigger of inflammation. So typically when we think about illness, we think about it in terms of you having a genetic predisposition. So I was genetically predisposed to have rheumatoid arthritis. And we call it a second hit, like there's a second hit, something else, which is in medicine, we call it the unknown trigger, but often we think that that's lifestyle, which then triggers inflammation, which then triggers illness. When we think about how to treat that, we often, as doctors, as medical doctors, we start at inflammation and illness. But what if you looked at it differently and you looked at it and said, okay, well, you have a genetic predisposition to illness, and you have a lifestyle that triggers or activates your genetic predisposition. I had just had my third child. I had 3 kids under 4. I was sleeping about 4 hours a night. I was pureeing sweet potatoes for my other 2 children while I was nursing and pumping. And then I was running to the hospital to manage heart attack patients all day long, and then rushing home to pump. So I wouldn't have to pump. So I would call my husband, I remember, and say, don't feed the baby. I'm coming. I don't want to pump. So the lifestyle triggers that I had in my life, if you could see any in that story I just told you, maybe you have a genetic predisposition, and then lifestyle actually activates the gene, which then triggers inflammation and illness. Well, what if we started further back and we actually treated you back here at the lifestyle and inflammation? Then maybe you don't ever get the illness. So what are those lifestyle factors that trigger inflammation? Well, I always think about it in terms of a scale. And so you need a balance between the stresses in your life and the resources. And this is an image from our book. And those demands and stresses are in our body. Most of us know really well, and you don't need me to tell you what the stressors are in your life, like poor sleep and mental stress and water pollutants, highly processed foods, instant foods, sedentary lifestyle, environmental toxins. Well, these are the demands on our body, and the mental stress is a big one right now with all of the infection we've had recently, and social media, and work stress, and then the kids' stress. And those things are very strong stressors in our life. And in terms of resources, though, what people forget is that we have loads of resources too, like exercise and yoga and clean water and meditation and eating more plants and having more restorative sleep. And if you think about it, most of us are living in a state of imbalance, right? Where there's too much stress and not enough use of resources. But when our phone goes to 3%, we panic and we rush for a charger because we don't want our phone to die, right? but why don't we learn to charge ourselves? Most of us live in this state of high sympathetic tone. We're always fight or flight. We're always running. Our heart rates are elevated because we're always moving, doing so many things. The number of patients I see in my clinic that are living in this high sympathetic tone state where they're just constantly on is over 50 to 70% of patients. And so this is a constant problem we're having in our society right now, where we're overstressed and we're not taking time for our resources. We're not taking time to recharge. It's almost like an embarrassment. I remember when I was in medical school, I used to say obnoxious things like, yeah, I didn't sleep last night, aced the test. You know, that kind of stuff is ridiculous. Like, that's not something to be proud of. We should be honoring the fact that we need sleep and we need to eat well and we need to take time for ourselves. But somehow we've forgotten that. We've forgotten how to take time for ourselves. And that word self-care is one that I take very seriously. So why did I get rheumatoid arthritis? Well, I had the genes for rheumatoid arthritis, and then I had inflammation, which then triggered illness. So that's important to appreciate. And the reason I brought that up is because I wanted to appreciate other chronic illnesses before I dove into heart disease itself. But it is Heart Month this month. February is Heart Month. And so I don't want to forget that heart disease in itself is an inflammatory process. There are many risk factors for heart disease, many of which some of you may have: high blood pressure, high cholesterol, obesity, or carrying central weight despite being thin but having weight in the center, diabetes, that's type 1 or type 2, smoking, and high levels of stress. These are all risk factors for heart disease. So when you think about heart disease as an inflammatory condition, well, you have a genetic predisposition maybe to heart disease because of your family history, but then you also have risk factors for heart disease, which can come either from poor lifestyle or from genetics, which then triggers inflammation in your heart, which then can cause a heart attack. So whenever I think about heart disease, I always like to show this picture because the heart, for instance, when your blood vessels their job is to open and close. They're really soft. I don't know if you can see my hands, but they're supposed to open when you need more blood and close when you need less blood. And so what happens is that when you're exercising, they dilate open. If you have really good endothelial cells, then, which are the inside lining of the heart vessel, then those blood vessels will open easily and close easily. Over time, what happens is if you have risk factors for heart disease, like high blood pressure, you smoke, or diabetes, you start getting damage to the blood vessel, and that's the image number 2. And then you start, as it gets damaged, the platelets come over and they build a little plaque inside, or a scab on the blood vessel inside lining. That destroys the endothelial cells, which its job is to open and close blood vessels. But then also, it causes that plaque, which then is like a little scab. And if you think about a circle, if you have a scab or something in the middle of it, it doesn't matter if it's outside of the skin, right? Because it can go as big as it wants. But if it's in a circle, then you can imagine that the tube is just getting more and more clogged, just like the plumbing in your toilet. So as cholesterol goes by, it starts attaching to that plaque, and the plaque gets bigger and bigger over time. What people don't realize is that when plaque builds up over time, is that most of the time, your whole life, you're not going to feel the difficulty with having that plaque because it's small growth over time. But then something triggers the plaque to rupture, and that's image number 3, which is inflammation. And when that plaque ruptures, it occludes the blood vessel completely or closes it off, and you can see how blood can no longer go through, and that's a heart attack. So I say I want to show that picture because I want us to see and understand how all these diets and illnesses are tied together by that role of inflammation. And then I also want to say, okay, well, now let's step back and say, how do we improve and decrease our inflammation? Well, in this topic, for this talk today, we're going to focus on diet. And so what we eat is you can actually trigger inflammation through your diet, and that connection is through your gut flora. So diet, gut flora, inflammation, and illness. So how does the gut affect inflammation? Well, it's very important to know some fundamental concepts of the gut. And I'm not a gastroenterologist. Like I remember telling people when I went into cardiology, I said, I like to stay above the thoracic cavity. That's a doctor joke. It just means I like to stay from the diaphragm up, which means I don't want to deal with the poo. But here I am, ironically, as a cardiologist, very, very focused on stool and poo, because at the end of the day, it is actually very, very important to our heart health. So how does the gut affect inflammation? Well, if you have this, there's millions and millions of bugs. Let's just start there, all in your gut. Millions, actually trillions of bugs in your gut. And they're all over, and they're actually all over your skin. They're in your vagina, and anything that's exposed to the outside of the body is bugs. Okay. And all of those, they're good bags and bad bugs. There are good bugs and bad bugs. Most of them you hope on your body are good bugs, and you need those good bugs because they are going to they're going to fight infection. They're going to decrease inflammation. When you eat foods that are low in fiber, however, and highly processed, you actually lose some of those good bugs, and you actually get a lot of bad bugs. So you end up getting a whole lot of one type of bad bug. And that's what we talk about when we have lack of microbial diversity. That means your bugs are all the same. Well, that's a problem because you need a lot of diversity of your bugs, and you need a lot of healthy gut bugs. And those come from eating high fiber and low processed food. So microbial diversity is one thing we're looking for to decrease inflammation. And we're also looking for increased short chain fatty acids. And don't worry, I'm going to explain this in more detail. And the short chain fatty acids are actually things that your body makes. So your bacteria actually make these things called short chain fatty acids, which then decrease inflammation. The third thing is negative metabolites. We want to avoid them, like TMAO and endotoxin. And then there's the topic of the leaky gut. And I'll go through them briefly. So you want to make sure to keep a microbial diversity, and that decreases inflammation, and that will come from high fiber foods, removing processed low fiber foods, and increasing fermented foods. I hope when you're thinking about what are those fermented foods, because I'm hoping that we're going to talk about fermented foods in the question and answer section. So this is a slide that shows that if you eat fermented foods, and so that's the bottom one, if you eat fermented foods, this was a study that was done out of Stanford, that if you increase the fermented foods in your diet, you will increase your bug diversity. Yes, that's what we want. We want more healthy bugs. So fermented foods actually are like natural probiotics. They have all these bugs in them, and they're the healthy bugs. And so when you eat them, you increase microbial diversity and you decrease inflammation. That is an incredible concept. The top part of the slide is interesting because it shows that actually when you eat too much fiber, it doesn't actually initially, it actually increases inflammation. Not to panic. Why did I just tell you to eat fiber and just told you that increasing fiber, increasing inflammation? I often tell people the way to understand that is that this shows that we have to build up the amount of fiber in our diet over time, because it does take time. We do absolutely need fiber in our diet, but people who have not been used to eating any fiber and they start eating fiber, you know what that feels like, some of you, where you start eating it and your body's like, whoa, I cannot tolerate that. And it's not that your body can't tolerate it, because people will tell me I can't tolerate beans or I can't tolerate this, it makes me bloated. Well, it's actually those foods that you absolutely need. You just need to add them in more slowly. And those are things I work with people. So this is those short chain fatty acids, and this is a thing we want to have more of them. So any of them, they're all good. They all are anti-inflammatory and anti-cancer. So there was a great study that was done on Africans and African Americans, and the Africans were eating a plant-based diet primarily with a little chicken and a few eggs. And African Americans were eating a standard American diet, which was more refined, a lot of fast food, lots of sodas. And they looked at their short chain fatty acid intake, or their stool, and how many short chain fatty acids they had. So this is interesting. If you look on the y-axis, it's the feces, and then on the x-axis, you can see the different short chain fatty acids. And the white bar is for Native Africans, and the black one is African Americans. And what you can see is that the Native Africans have way more short chain fatty acids than the African Americans. And they also did colonoscopies on these patients, and then they found the Native Africans had literally zero polyps in their blood, in their stool, in their colon, whereas the African Americans had polyps in their colon. And so some people would say, the scientists in the room will say, well, that's just genes. You know, some people are genetically predisposed to polyps and some are not. True. But then what they did in the study is that they actually changed their diets. They gave the African Americans the African diet and the Africans the African American diet. And in 2 weeks, 2 weeks, hold the phone, 2 weeks, they were able to show that all of a sudden the native African short chain fatty acids went down and the African American short chain fatty acids went up. So within 2 weeks, you can make a change in your short chain fatty acids by adding in more of those plant-based foods. So what about meat? And what is this thing called TMAO? So why am I focused on plant-based eating? So this was a study done out of the Cleveland Clinic, which is a great institution, and they looked at meat products and what it does to your gut. And so they found this substance called TMAO. It stands for trimethylamine and oxide. You don't need to know that long name, but if you Google TMAO, you'll find it. And we have found that TMAO actually worsens cholesterol metabolism, triggers inflammation, actually builds plaque in the heart walls. So what they did in this study was they actually injected this meat products, so that are high in phosphatidylcholine, like cheese and eggs and red meat, and they gave it to people to eat. And what happened was it goes into your gut, and then they measured the amount of TMAO people made. And what they were able to find, and so we're clear, foods that are very high in phosphatidylcholine are only found in animal products. Yes, there are plant products that have phosphatidylcholine, but not to the same degree. And they found that when they ate those foods, they made high amounts of TMAO. So what? Like, what does that even mean? Well, this is a nice graph showing that on the y-axis, that's heart attack, stroke, or death, and that's years in the x-axis. And the higher amounts of TMAO, so that's quartile 4, so they had the most TMAO, the higher amounts of TMAO had the higher amounts of heart attack, stroke, and death. That doesn't mean that because you ate red meat, you're going to have a heart attack. Don't panic. It just means that those foods create more TMAO. And when you eat have higher amounts of TMAO, it's associated with higher rates of events of heart attack, stroke, and death. What was neat though, and this is a slide that shows that they compared the omnivore versus the vegan. And I don't know how they got vegans to eat those animal products, which I thought was really interesting, but they did. And what they found was that the omnivore, within 12 hours of eating the animal products, their TMAO levels go up. But the vegan vegetarian, if they eat that lifestyle, their TMAO level almost doesn't increase after eating it. And I think that's really important to see, because people often ask me, like, if I eat meat once in a while, is that such a big deal? And I tell them, I don't really sweat the small stuff. You know, I don't really worry about the once in a while. It's the everyday, right? When you eat it every day in that omnivore diet, that's when you're getting a large amount, decreased microbial diversity, decrease in those short chain fatty acids, and increased amounts of TMAO. Whereas if you eat almost exclusively 100% plant-based and then every so often have a little of this or that, I don't really care. So the last concept related to the gut, because I'm a cardiologist and I really don't like the gut so much, is the leaky gut, and that's called intestinal permeability. And this is another slide from our book, but this is just to give you a sense. If you look at the picture on the top, that's gut. That's where your poo goes through. That's the lumen of the gut. So that's the intestine. And if you open it up and fillet it, you'll see the image number 2, which has those little fingers on it, those little like hair-like fingers. And that's what your food, as it's going through, it touches. And what happens is if you have something healthy, it allows it through into your bloodstream. And if it's not healthy, it takes, or we don't want it, it rejects it and it goes out into your poo. And this is important because this is where a lot of inflammation happens, is in the gut. And so you have all these protective cells in your gut that protect you from invaders, bad things from your food that you're eating, from getting into your bloodstream. So if you eat, so you have, I always call them, you have the cavalry, which are the intestinal epithelial cells. You have the healthy tight junctions, which are like the fence or barricade. You have the dendritic cells, which are the soldiers on horses. And then you have the big guns, the Navy SEALs. Those are the B and T cells. So those are all there to protect whatever might come through when your body needs it. But what happens is that some people, that happens is their junctions or their barricades break. And when those barricades break, your body allows in intruders and allows the trigger to trigger. Then your body, all those white cells, don't worry, you've got the cavalry, you've got all these cells in there to prevent you from getting sick. But when your body is affected over and over again by some toxin or invader that breaks those junctions, you trigger more inflammation. Well, what are those invaders and what breaks those junctions? Well, I often tell people about the concept of celiac disease. We're not talking about gluten sensitivity, but specifically celiac disease, which are people who are allergic to wheat. So they can't eat wheat or gluten, right? And so when they eat wheat or gluten, and this has been studied, the junctions in their stool or in their intestine, they break. As soon as they eat them, they break. And so what happens is that all these invaders come into their body and they get a little bit of inflammation first, but the more they eat that wheat and gluten, they get more and more inflammation. Well, your body's not stupid. It's not going to allow only the inflammation just to sit in the gut. It also spreads it around the body because it's trying to get rid of it from its main location. And that's why celiac patients don't just have diarrhea. They also get headaches and rashes, and little kids can get seizures, and you can get infections in other parts of your body because the inflammation goes everywhere. So if you think about that concept, that the celiac patient eats wheat that breaks the junctions in your gut, which triggers systemic inflammation or total body inflammation, it can make you realize that other people maybe don't have a reaction to wheat, but maybe you have other foods that can break those junctions for you, which can trigger systemic inflammation. So for me, I think that if I got rheumatoid arthritis and that dairy was a big trigger for me, which activates or triggers and breaks my tight junctions, which triggered systemic inflammation and rheumatoid arthritis. So then in theory, if you change your diet, you'll improve your gut flora, you'll decrease your inflammation, and you decrease your illness. Okay. So that was a lot of stomach. So I hope you guys can just, if you need to stand up and shake, that's okay, because I often need to do that because gut is like, whoo. So let's talk a little bit about more you can do. Like, what are the practical things that you can do to heal your body? Well, currently health is at an all-time low in America. If you look at the study that was done to look at what people are dying of, the number one thing that's triggering death in Americans is dietary risk. And that's actually triggered by most commonly due to heart disease. You can see from the blue that it's most commonly due to heart disease. So what's wrong with the foods that we're eating? And what is so wrong with the standard American diet? Some people call it the SAD diet, which always tickles me. Well, it's high in red meat. It's high in refined grains, processed foods, high-fat dairy, desserts, non-nutritious calories, and high sugary drinks in particular. So less than 1% of adolescents and only 2 to 3% of adults obtain the recommended daily intake of fruits and vegetables. 1% of adolescents. 75% of packaged foods in the US now contain added sugars, and most of that's coming from sugar-sweetened beverages. If you look at these drinks, people love like the Naked drink, which is 100% juice smoothie. There's 60 grams of sugar in a Naked drink. Or what about an iced coffee from Starbucks? 31 grams of sugar. A Naked drink at 60 grams is 4 times the amount of sugar you should have as a woman in an entire day you're getting in a 100% Naked juice smoothie. So I live in Florida, and that's where I'm calling in from. And a lot of people tell me, like, and I've heard this directly, where people say, Dr. A, this here's the South. We like to eat our meat and potatoes. Okay, well, is that okay? So eating a Southern style diet was studied compared to people eating a more standard a standard high fiber, more plant-based diet. And they found that eating the Southern diet put you at a 56% higher rate of heart disease, 50% increased risk of kidney disease, and 30% increased risk of stroke. So while you may want to eat those foods and know that this is how you've been raised your whole life, that's okay. It doesn't matter that you were raised some way your whole life. It's about the changes you make at the now, right? And so it just takes time. I have people who I work with in my clinic that are hunters and farmers that are cattle farmers, and they change. They all change. They change because it's better for your health. And so it doesn't almost matter where you start. It's just about making sure you're changing every day. And as the shirt says, just focus on eating more plants. Don't sweat the rest. So what else about the quality? So it's not just that the quality of the food is actually poor. The amount of food we're eating is actually so much higher. So if you look at the food, the size of a burger in 1950, it was 3.9 ounces. And now that same burger is 12 ounces. French fries gone to 6.7 ounces. Look at the soda. Holy smokes. 7 ounces in 1950 is now 42 ounces. So with that, 70% of Americans are now overweight or obese. And no longer are children looking like the child on the left, but they're looking like the child on the right. And now with the new guidelines that came out in 2017 and our new change of what is high blood pressure, we're actually finding that almost 1 in 2 people, 50% of Americans, 1 in 2 people has high blood pressure. 1 in 10 people has diabetes, 1 in 3 people have pre-diabetes, and over 10% of the population's cholesterol is too high. All right. Enough of the depressing stuff. Let's get to what we can do to fix it. So I always remind people, there's some non-modifiable risk factors. You can't change your genes, your race, your age. Okay, fine, your gender. But you can change so many things like your blood pressure, smoking, diabetes, activity. And how are we going to do that? I'm going to skip that. Well, we're going to change your lifestyle. And why does it actually work? Does it actually work? Is it really worth the trouble? So this is the last comprehensive slide I think I'm going to show you, but it's a nice one. And this is genetic risk on the x-axis and plaque on the y-axis. So coronary artery calcium is plaque. And if you have low genetic risk, intermediate genetic risk, or high genetic risk, and then the red is unfavorable lifestyle and blue is favorable. And don't get overwhelmed. I'm going to explain it to you. So say you have low genetic risk. That means your dad lived to 425, mom was 500, you're going to live forever, right? So if you have a favorable lifestyle in that person, it has low genetic risk and a favorable lifestyle, the likelihood over their lifetime that they're going to have calcium is very low. About 15 is their number. That's actually very low. But when you have an unfavorable lifestyle and that low genetic risk, then you're going to double your risk of that 15 to 31. So similarly, if you have high genetic risk, so that means your dad had a heart attack at 45, well, and you have a unfavorable lifestyle, your calcium number is 64. But if you have a favorable lifestyle, despite your genes, you can reduce your risk by 50%. So I like people to see that because I want people to see how much impact lifestyle can make on your body. So there are many heart healthy diets that are advocated by the American Heart Association and American College of Cardiology. The 3 main ones are the Mediterranean, the DASH, and the vegetarian diet. Why are you not being told about this on a daily basis by your cardiologist? Well, the reason is because when we studied cardiologists, we found that actually when we polled all cardiologists, 1% of MDs felt they received a high level of nutrition education that gave them excellent skills for counseling patients. And we looked at fellows in training, so junior doctors as well. And when they had a 0%. So we weren't getting any better at doing nutrition education. So that's why I started a prevention clinic at the University of Florida, and what we did was focus on nutrition and lifestyle, because I wanted not only to teach patients how to eat better and work on their body better, but I also wanted to teach new fellows, teach the upcoming doctors about nutrition and lifestyle. And the goals of my clinic are to treat risk factors and use medications. I'm not afraid of them, but to also remember to complement medications with lifestyle changes to decrease inflammation. And very often people are able to get off medication, which is a huge treat. So in my model, I usually do 1 hour long visits. I have a yoga room and a meditation room. I do extensive nutrition counseling. And what I do is I like to study things and see if I'm better. And the truth is our clinic does better. If you look at the patients, they had improved quality of life, reduction in medicine, better cholesterol, decreased weight. And what we did is we presented this at the American College of Cardiology, and people were blown away. So what are the goals? So here they are. We want to remove all of your red meat. There's really no reason you should eat red meat. If you want to eat it once in a while on a blue moon, I don't care, especially with the TMAO data, but I really would like you to remove your red meat. If you want to keep chicken a little bit or poultry a little bit, but that's okay. But I prefer you focus on mostly plants and a little bit of fish if you'd like. Working on eliminating most of your dairy, and then eliminating your simple and refined foods. So if it comes in an instant 3-minute quick cook, you don't want to eat it. You want to eliminate your processed foods, that things that on the ingredients list that you've never heard of, you don't want to eat. You don't want to eat things that are preservatives, artificial sweeteners. We want to avoid all trans fats and avoid saturated fats. What do we want to eat then if you're taking everything away, Dr. A? Well, I want you to eat loads of plants. So we should be eating 5 to 7 servings of fruits and vegetables per day. What's a serving? I always ask that question. Well, a serving is a baseball-sized fruit, a serving of uncooked vegetables, or a half a cup of cooked vegetables. There's a typo there on that slide. Sorry, a half a cup of cooked vegetables. But we want to be eating 5 to 7 servings per day. Well, how do you get all those servings in, Dr. A? You're crazy. Well, what if the breakfast was oatmeal and it was steel cut oats with blueberries and flax seeds? And what if lunch was a huge salad that had loads of veggies and nutritional yeast and chickpeas? And what if dinner was beans and rice and steamed broccoli and sautéed Brussels sprouts? And what if dessert was mangoes and some dark chocolate? Like how many? Then I would absolutely have gotten my 5 to 7 servings of fruits and vegetables. I'm getting hungry. Is it lunchtime? So I also want you to think about removing reducing your omega-6 fatty acids and increasing your omega-3. And omega-6 is a common oil we use for a lot of household oils, and we really want to shift to eating more omega-3. And you can get those in fatty fish, you can get those in walnuts and chia and flax seeds. Anti-inflammatory spices, for instance, for me, turmeric is a big one because it's such a powerful anti-inflammatory. We want you to eat unsaturated fats, complex carbohydrates like beans and tofu, and fermented foods. So wait, I thought carbs were bad. Like, am I allowed to eat carbs? Are you kidding me? Like, sweet. So remember, there's such a thing as a bad carb and a good carb, or a complex carb and a refined carb. Well, simple carbs like pasta, and pasta is actually a complex carb, but no fiber. So basically it's very refined. And so unless you're getting sort of the more complex pastas, also sugar sweetened drinks, cookies and cakes, those are all very simple and refined foods. And they are going to have a high glycemic index, and they're going to activate your insulin and make you gain weight very quickly. They're the foods that give you your highs and lows. So think about when you eat lunch and you go to Olive Garden for lunch, and then after you eat your lunch, what happens 20 minutes later when you sit at your desk? You start nodding off, right? Because you've just gotten this huge high of sugar when you ate your pasta, and then it starts coming down because the insulin level went up and then insulin level went right back down. And so you get tired, and so you get up and you're like, oh God, I need to have a cup of coffee. So you go get your coffee, and what do you put in it? Sugar and milk, which also just make you go up and down. So most people are going through their day up and down and up and down. And then they come away thinking, God, I need to eat more protein, or I need to sleep more. Well, you probably do need to sleep more, but you probably need to not eat as much protein as much as you need to cut out your sugar. So the good carbohydrates are things like beans and greens and loads of greens, and some fruits, many fruits. Just to remind you that we want to eat about 50 to 55% of our diet should be carbohydrates. And this just shows that when people hazard ratio means this is an event problem, so the risk of dying. So if you eat too many carbs, that's 80% of your diet is carbohydrates, you're going to have a higher risk of events. But if you eat too low amounts of carbohydrates, like 20% of your diet, so the people who eat ketogenic and very low carb, I'm not a fan of that, because you can see that very low carb diets are associated with high event rate. So we want you to eat complex carbohydrates, 50 to 55% of your diet. Don't be afraid of those complex carbs. Eat oatmeal, eat brown rice, eat potatoes, eat beans. These are really, really good for you. Well, why did Time Magazine tell us to eat butter, that scientists labeled fat wrong, and why were they wrong? Well, so clearly we're wrong, right? Is that right? So we studied this over 30 to 40 years, some of the best scientists in the country, Walter Willett included from Harvard, and we found that if you eat high amounts of saturated fat, you're going to have higher amounts of heart disease. And if you replace the high amounts of fat, saturated fat, with unsaturated fat, you make people better. So then why did Time Magazine say that we had it wrong? Well, it's because depends what you replace it with. So if you eat the food on the left, those kind of saturated fats, and you replace it with that Olive Garden meal, I shouldn't pick on Olive Garden, sorry, but this sort of refined low fiber pasta, then we're going to make people worse. But if we take saturated fat and we change and we remove them and we put in a very complex carbohydrate meal like the one on the bottom right, we're going to make people better. So it's not that saturated fat is good and carbs are bad, but it's rather that saturated fat is bad and refined carbohydrates are as bad, if not worse. So I did lie to you. There is one more complex slide here, and this is a risk here. So this is changes in risk. So you're going to increase risk if you're on this side. You're going to decrease risk if you're on this side. See the negative numbers here. And you're going to increase risk if you're on the right side of the unity line. So if you eat saturated fats and then you change them and put in trans fats, well, you're going to make people worse. If you eat saturated fats and you change them with unsaturated fats, you make everybody better. If you have saturated fat and you change it with refined carbs and added sugars, you make people worse. And that's the key, that we don't want to take away saturated fat and then eat crackers and cookies and cakes because we're making people worse. But if you have saturated fat and you eat complex carbs from whole grains, you make them better. And this to me is the fundamental nut of what Time Magazine had wrong. So here's just a quick slide on blood pressure to remind you that there are many medications that I use in my clinic every day, ACE inhibitors, beta blockers, calcium channel blockers, that all bring down your blood pressure significantly. But if I put somebody on a DASH style diet, so a plant-based diet that's low in sodium, I can drop your blood pressure 21 millimeters of mercury. That's better than any one medication that I use. Does diet work? Heck yeah. Does it decrease your inflammation? We compared a plant-based diet that was 100% plant-based to American Heart Association diet, and we decreased their inflammation. So think about that inflammation number. So here's one of the last slides here that just talks about plant-based diets that are healthy and unhealthy. And we know that this is heart disease risk on the y-axis, and this is the healthy plant-based diet on the red, and an unhealthy plant-based in this gray dotted line. And you want to be down here below this number here, 1. And so you can see that if you eat a healthy plant-based diet, people are going to do really well. But if you do an unhealthy plant-based diet, you're going to make people worse. So make sure to stay on the left side of this line. You want to be eating those healthy plant-based foods and not the unhealthy ones. So at the University of Florida, we actually changed the entire menu for all of our cardiac patients. So all of our cardiac patients, I'm very proud of this, now have the opportunity to eat off our 100% plant-based diet menu. that was a year in the making. So how do we impact change? Well, we may impact change by teaching our fellows, right? We're working on our trainees to improve them. We're passing out education. We're talking to patients and communities like Ardmore's fine group of people, where we talk to them to impact change. We're getting into hospitals to move towards more plant-based eating. We're trying to teach physicians. So this is a program I ran where I brought doctors into a cooking class. It was I took 40 people in, 80 people were on the wait list, and it was gangbusters. It was so fun. So last few slides, because I am the medical director of the Four Roots Farm, because I want to remind everyone that it's not just about eating more plants. We also have to think now further back to how food is actually made. And now 50% of the soil in America is actually no longer soil, it's dirt. Well, what's the difference between soil and dirt? Well, soil is full of the healthy microbes that help your plants grow strong and fight infection, whereas dirt has nothing. And now, despite that, 50% of our food is actually imported. We're getting all of our food from outside of our country. So we're not only not able to, we have farmers here that are not being supported, that are growing, that don't have land now to grow healthy food, and we're importing so much of our food. So 50% of the world's topsoil's dried up and turned to dirt, and we have a broken food system. We have about 1 in 5 children who don't know where their next meal is coming from. This is the first time in history that our kids actually are going to have a shorter lifespan than their parents. We have 330 farmers that are losing their land every single week. And the average distance that produce travels from farm to plate is 1,500 miles. But despite that, in Florida, which is where I'm from, 800 million pounds of food is actually grown and never even gets to market. So there's such a dysfunctional state where there's not enough soil. We are growing less. We have all these farmers that are selling because they aren't supported. And then we have food that is growing and we can't get that to people, and our kids are starving. So at the Four Roots campus, we're growing a building in Orlando, Florida. It's an 18-acre campus that is a complete nonprofit organization that's going to have 8 different growing methods. We're having an event center, a restaurant, an outdoor pavilion, and we have something that I'm most proud of, which is the Culinary Health Institute. And in the Culinary Health Institute, we're going to specifically be working on improving nutrition. We're talking a lot about how people should eat, teaching people how to cook. I run these cooking classes in Orlando, and it was really fun to see. And some people don't know how to cut garlic, and some people don't know how to squeeze a lemon. That's okay. There's no judgment, but we have to go back to learning those things. We have kids that sometimes come to the farm and have been given food, and their parents throw the food away. And they keep throwing the food away. And we've asked, why are your parents throwing the food away? And the parents say, well, the food comes from the dirt. We're not going to eat that. But there's such a disconnect, right? We have to appreciate that it's not that, it's just that we aren't doing it. If that is what people are thinking, that the food is coming from the dirt and that's bad, then we are failing as a society, because we're not teaching our students and our kids and our next generation that that's what we want. We want that healthy food from the soil. So there's just some images of the campus that I just think are so pretty. And so I'm just going to quickly fly through those because I just love them. And there's, of course, our Culinary Health Institute, which I've labeled changing the way people view food and food as medicine. Over there, we're focused on research, education, whole health, innovation, and sustainability. And then I'll just close with that to remind you so many different things, but the key and the nut of healing your body has to do with this slide. It's the imbalance that we have in our bodies that triggers inflammation. We have too much stress and not enough resources, and we want to improve and add in. And remember, just like our cell phone, we too need to be charged. We need to take care of our bodies. We need to take care of our souls. We need to take care of our brains. We need to nurture ourselves. We need to eat well. We need to eat well. We need to eat well. Did I mention eat well? Exercise, yoga, clean water. All of these things are needed to heal our bodies. So you have 2 choices. We could perform triple bypass surgery, where we take a vein out of your thigh, open up your chest so we can sew the vein onto your coronary artery. this costs more than $100,000 and will keep you laid up for at least 2 months. Or we could put you on a vegan diet. A vegan diet, GDoc, that sounds pretty extreme. Bottom line, eat more plants, do the best you can, and every day try to do a little bit better and support your local farms and be part of the change. Thank you so much.
I feel like I want to say thank you so much.
Let's clap you, but that was phenomenal. I am so inspired by your passion, not just your knowledge. The knowledge part was going to be there, but just your passion for growing food and educating people about food and how to eat more of these high fiber plant foods that we are so excited about here at Full Plate Living. So thank you for sharing that with us.
My pleasure. I'm sorry. I hope it wasn't too long and boring.
Not at all. I will go ahead and ask you just to quit sharing your screen. That way we'll all three pop up and we'll go through some questions. I know we have a ton of them actually still coming in, so I'm going to go through those, Michelle, and mark them.
Excellent. So we do have quite a few questions, and I'm going to start with the fermented foods one for a number of reasons. One is you wanted us to talk about fermented foods, and we have the questions. So let me find them all. We had a couple of them. I'll ask the first one that I remember, and that was, is wine a good fermented food choice?
So, wine has its goods and its bads. So I like to drink red wine. Oh, can you hear me?
Yes. Yeah. Mm-hmm.
Okay. Sorry. I thought Michelle was talking and it was weird. Okay. So wine has its goods and bads. And so overall, I think that most of the time it's a good thing. I'm getting a weird screen.
Oh, that's just the question, just so everybody knows what we're answering.
Oh, I see. Okay, thank you. And so in general, there's there's some interesting data on resveratrol. It is part of the Mediterranean diet. Is it bad? Probably not bad. Probably good for some people. We just have to consider, though, that it can make your blood pressure go up. It can also trigger palpitations for some people. Certainly, I started getting palpitations because when I was drinking red wine, so I actually cut it and my palpitations went away. And so but overall, I think a couple of glasses of wine a week is not unreasonable. I do think that people drink too much, and that's a little tricky because a woman should really only drink 1 glass of red wine or alcohol a day, and that glass is not as big as you think. And so people often, especially during COVID, I'm seeing a lot of heavy drinking, and really want to remember that we really want to be focusing on 3 to 4 ounces of red wine and for a woman, and a man can have 2 based on their body mass.
Excellent. Thank you for that. So what are the best types of fermented foods? How important is diversity of such? Kombucha is the only fermented product in my current diet. Should I consider others?
Yes, you should consider others. So kombucha is my least favorite, I'm sorry to say, because it actually is loaded. It has a lot of sugar in it. And so it's not that sugar isn't used in fermented foods in general, but there's more sugar in kombucha and it's broken down differently. So you actually get a lot more sugar in your body. So we want you to eat sauerkraut, kimchi. Kimchi is my favorite. I eat a load of kimchi. I will probably have it with my lunch today. So kimchi is a good one. Tempeh is a fermented one. Those are sort of the foods in general that I tell people to have. And is microbial diversity important? Absolutely. It's not as much about the diversity in the fermented food that you get as much as diversity in your food products, which will then promote microbial or bug diversity.
It's very interesting. You mentioned Stanford. I actually saw Dr. Sean Spencer speak last week, and man, that information that you shared was just spot on with what they're doing and just the future research that they're going to have with the gut microbiome. And the constant theme to everything was fiber, fiber, fiber. Eat more plants. Eat more plants. Don't sweat the rest. Don't sweat the rest.
Well, so the next question, I'm going to move away from fermented foods because I feel like you really answered it. Another big one, so I'm going to throw it out there for a lot of people, they depend on yogurt for their fermented foods. What is your take on that?
Yeah, so, the dairy data is, can you hear me? Okay.
Yes.
Okay, I don't know if there's a delay in Michelle because she looks like she's still talking and then she stops. So it's interesting. Okay, so yogurt is interesting. So in general, I'm not a huge fan of dairy, and so I think dairy in particular for me is inflammatory, and not necessarily for everybody, but it's also super high in saturated fat and sugar. So often I'll cut out dairy just to reduce your cholesterol. Yogurt of all the dairy products is the one that really doesn't show a negative. And so if you want to eat some yogurt, I'm not against it. It's just to be real careful because most people are eating those yogurts with the fruit, and that fruit is loaded in sugar, and often they have added sugars, and so the ratio ends up being different. Like if you get plain yogurt, I guess, and then add in your own fruit, that's a better situation than the turn over the cup thing where you're getting or mixing the yogurt thing.
Excellent. I knew this question was going to pop up. Where do you get protein from? If you're cutting out all the red meat, and where do you get protein besides fish?
Yeah, so you get protein from so many sources that people don't realize that are in plants. So one of the biggest sources is beans. And so people don't realize that beans have a load of protein. And think about tofu and tempeh. And so I have no shortage, and almost every single American has no shortage of protein. Maybe there are people that are starving, and I hate to think about those poor kids that may be having that situation that may be protein deficient, but most of us, we're not suffering from protein deficiency. And people who are super athletes, which I have many in my clinic, they come to me and they say, well, how can you do that on a plant-based diet? You just do it more carefully. So people who are trying to build bulk and trying to build bulk through a plant-based diet, it absolutely can be done. Some of the best athletes in the world are plant-based. Tom Brady being one of them. Some people might say, oh, he's not as clean. Okay, well, there's Dotsie Bosch, and who former Olympian. There's millions of football players. They're not coming to my head right now. There's that weightlifter that is ridiculous. I mean, there's just the number of people that are plant-based and athletes. It's a non-issue. Venus Williams. And so I just think that most people have this perception that they're not getting enough protein, and that perception's incorrect. And most of the time we are getting enough in a plant-based diet. Step change that. We are getting enough in a plant-based diet that's loaded in beans and like I said, tofu and tempeh. So that's what I would focus on.
We also have a workshop all on protein. I will put the link in there, and it's a good 30-45-minute workshop just on protein. So if that's a subject you want to dive deeper into, check out the link I just put in there.
Thank you for linking that, Amy. Here's a question. I'm on sugar-free and lowered my carbs, feeling better, but my emotions are so low. I kind of feel disappointed. I'm in this to lose some weight.
So I wish I could talk to Jan a little bit more detail. Does she mean she's in this low carb thing to lose weight? I think is what she's trying. Go ahead.
It sounds like it.
Okay. So, I'm sorry you're disappointed. I'm sorry your emotions are low. And I would wonder, a little bit about that. Are the emotions low and that's triggering some of the sadness, or are you suggesting that the low carbs or eating low sugar makes you sad or is making you feel sad? And that I'm not clear on. But I guess what I would say is that in my whole life, I have never counted a carbohydrate. I just don't understand it. And the only time that you really need to count your macros is if you're training for something. The rest of us don't really need to count macros and really just need to focus on eating whole food, plant-based. Now, again, I don't care if you eat a little bit of this or a little of that. I mean, everybody wants a cookie once in a while. So what? It's not going to do anything. It's the slippery slope that happens as long as on a daily basis you're getting those healthy foods. And so what I would encourage you, Jan, is maybe talk to somebody about what sugar, do you have to be completely sugar-free? And maybe if you're eating complex carbohydrates throughout the day, you're getting some of those sugars, and then maybe that's going to keep you more energized and activated, and maybe your emotions will be better. And then it'll get you more exercising, which is a huge endorphin rush. Just a thought. I don't know enough, and I don't mean to presume I do.
Yeah, and it sounds too, I think, a little bit like she's maybe just started with full plate. So, I mean, go through the program that we have. It will help you start to change those plants, and just know you're not alone. You know, join us in the community and connect with those of us who really are trying to do this in our lifestyles.
Here's one that's more specific to heart disease. How do you reduce triglycerides?
So triglycerides are it's a sugar and fat compound in your blood. And some people are genetically predisposed to high triglycerides, and they will have a lot more trouble with just diet alone. But people who are, most of the rest of us are not genetically predisposed to high triglycerides. And really, it's a combination of cutting your fat and cutting your simple carbohydrates. Those are the things that are going to reduce your triglycerides. You have to do both.
Excellent. All right.
So I should also say that there's medications that you can use to bring down your triglycerides that are available through your physician.
I know another thing I'll plug in, because you're talking about blood numbers. If people have not gone to their doctor or do not have a regular annual visit scheduled, please do that. I mean, that way you know where you're at on some of these things, and it's not just guessing and then, you know, playing around with it. I know that's one thing. Sometimes people are like, oh, well, I can do this, I can do that. Where are you? So if you know your triglyceride numbers, great. If you know your A1C, great. Are there certain other key factors you would recommend, especially if heart disease isn't as a concern?
So yeah, no, I think that if you are checking your inflammatory, so some people, you really do need to just see your primary, because they're going to check your blood pressure, they're going to check your heart rate, they're going to see how, they're going to check your weight, your body mass index, all those lipid markers, anemia, thyroid, menopausal symptoms. And as I get older, I'm starting to realize the impact that menopause has on your body, and important to appreciate those menopausal symptoms as well.
Yeah.
Yeah.
Do you have, I have a follow-up question to that, because we get asked this a lot too. Do you have any recommendations on scouting out a great doctor, you know, that will be more like-minded in this area? And not all doctors have, like you said, the education. Are there certain, you know, key pieces that we should be looking for in our doctors?
It's super tricky. I get that question a lot too, and not because it's, and I don't mean to evade the question. So there are a couple of websites. There's plantbaseddocs.org that has some docs on it, but that's a paid service. So a lot of docs who are plant-based don't use it. The other thing I often tell you, you kind of have to Google it. It's not that you need somebody that is plant-based as much as you need somebody in your area that's open to lifestyle. And that's the key, because you want somebody. And so there's some areas where the people get frustrated and they say, well, there's just no lifestyle-based or plant-based doctors in our area. Well, don't fret it. As long as you have somebody who's open to learning or understanding about, or will consider an alternative approach. And it is tricky though, because a lot of people are looking for guidance from their doctors. And so I encourage people to use podcasts, but the podcasts are out there. There's so many bad ones. And in fact, that's why I actually started a podcast. This is not a plug as much as to say, the reason I did is because I think there's so much misinformation out there on what to eat, and people are so confused. And some people come to my clinic and they say, like, I just don't know what to believe. And I get that, because there are so many people who are like, some people are out there and they're like, eat meat, eat steak, you know, and then and people are like, well, I was told I can't eat carbs. Carbs are the enemy. So it just becomes so confusing, and I appreciate that. So not a great answer. Certainly trying to find people that you can trust from great institutes like Ardmore, which I'm sure you have a good list. And then of course, plantbaseddocs.org.
Excellent. Thanks. Sorry, on to the next question. I know that's one we get a lot too. So
fun question, because I found it was interesting. So maybe if you can tell us in a typical day, so what are typical meals that you make daily? Just like an example of a typical day for breakfast?
Sure. So that's funny. I haven't had that one in a while. So okay, let's think about what I eat. So I am a believer in that as we age, especially, we need to eat less food. And I mean, that's actually not like I'm a believer. That's actually true, right? So what our conception is that we have to eat a lot of food, and we kind of want to eat the same amount of food we ate our whole life. But as we get older, we actually need to eat less. And so what I often tell people is you should eat maybe 2.5 meals a day, but you really don't need, or you can be one of those people who likes to eat 5 or 6 meals, but really small. Any of those work. I tend to be like a 2 meal kind of, or 2.5 meal kind of person. So for breakfast is my heaviest meal of the day. I often have either steel cut oats with blueberries and flax seeds, which is a very common one in my house. Or I really like to eat, I go to a local breadery where I get no oil, no sugar bread, and I toast it with hummus and kimchi. I often have that as a breakfast. For lunch, I almost always have a salad, which is usually baby kale, tomato, onion, whatever I have rotting in my fridge, nutritional yeast, and sometimes sesame seeds, some hummus, some balsamic vinegar. And then often I don't have dinner, or if I do, I will have some beans and rice or some lentils. I'm Indian, so I eat a lot of lentils. So I do a lot of lentils and rice. So I might have that for dinner. But that's usually and then some steamed vegetables. I like to steam broccoli. I like to saute Brussels sprouts. Those are regulars in my house.
Wonderful. You sound like you fit very well with Full Plate. We could eat meals together. What can I eat that will help me with vitamin D?
Not a lot. Not a lot of different things. So mushrooms, there's some mushrooms that will help. Mushrooms in general will help you bring up your vitamin D, but it's hard. You have to spend time in the sun, and the way that, I don't know, how you're feeling, your skin color, your tones, your risk of burning, your ozone situation, where you are. But the bottom line is the best way to get vitamin D is sit in the sun. 20 minutes a day usually, but if you live in the north, it's harder. North of America versus south. If you're in the UK, for instance, very difficult to get that sun exposure, but 20 minutes. And people who are light skinned, often tell them to wear sunblock on their face, which it does prevent the absorption of the vitamin D, but don't put sunblock like maybe on their legs, and let the legs be exposed to the sun, and you'll make the vitamin D there. Often people will have to supplement. So I do supplement with vitamin D.
Excellent. This is talking about foods that get cooked under 3 minutes. Do 90-second whole grain, I'm going to guess this is whole grain, packs count as eating whole grains?
So I can't think of a really true whole grain that can be made in 90 seconds or less. Am I missing any? Let me think.
I think it's more like the grain packets, like the quinoa, brown rice packets that are already kind of cooked and you're just heating them up in the microwave. I know sometimes they have other ingredients, and there's a lot of different brands. Turn it over and look at the ingredients on it.
Yeah, I think that's good advice. If they're pre-cooked, that's actually not so bad. If they're pre-cooked and you're just doing it in the 90-second thing, I guess that's probably not as bad. Whatever, we all have to make our lives easier. But yes, look at the ingredients, because often there's a lot of added salt in those as well.
Yep.
Yes. So in your practice, what do you recommend to somebody who is trying to eat healthier? They're trying to get on board, but their spouse isn't. And so they have to end up cooking so many different meals for their spouse, picky kids, themselves.
Yeah, that's tricky. I have heard that question quite a bit. And, when I first, so I grew up vegetarian. I went plant-based 11 years ago, 100% plant-based. And my husband at the time ate meat. 11 years ago, my husband ate meat. His idea of a good night was a burger and fries. And so I never once told him to change. And so, but I cook in the house. and I'm the only cook in the house. I mean, my husband cooks. I don't mean to suggest he doesn't cook. He's lovely, and amazing, and he does cook. But in general, he knows I only eat plants at the time. And so whenever he would cook, he would just cook stuff for our food, for our family that was plant-based. And our kids were all plant-based. So there was almost no choice. So we would just eat plant-based in the house. And so he would see how I was changing and how I was getting better and how our kids were doing. And so he started changing, and he is also 100% plant-based, but I didn't tell him to do it. And I guess what I would say is what I find is that I do best with my relationships and even within my clinic. If you come to me and ask me for help, then I will tell you how to change, but I don't tell you how to change if you don't ask. And so maybe that's the thing I would say about spouses is if your spouse isn't on board, okay. This is about you and your life and your body and your healing. And if you want to get better, just do it. And then slowly, I believe from experience and having done this, is that your husband will change. And if your husband loves you and wants to be on your experience with you and wants to heal and be better and around for a long time, hopefully they'll come with you on the journey.
That is a great answer. Thank you. All right, so this ties into your Indian heritage. Speaking of Indian heritage, does Ayurveda play into your diet? And should we consider our dosha constitution when transitioning to plant-based?
So I think Ayurveda always has had a persistent role in my life. I find it fascinating and interesting, but there are parts of it I don't understand, or I don't know if we don't understand enough. I think that everybody's body is different, and we do have to honor our bodies. And so in that sense, I believe in that Ayurvedic concept. So you do really have to listen to how your body is treating, but how is responding to the changes you're making. But I don't, so in that sense, I'm a believer in all of Ayurveda. But the things I like about Ayurveda in particular is the herbals, and those are the things that I'm most fascinated by.
Excellent. How long should probiotics be taken after antibiotics are finished? We're back to fermented foods.
Yeah, I love fermented foods, but so I don't know the answer to that. I don't think we know the answer to that. If the longer you take antibiotics, the more destruction of your natural gut flora. And so you probably need to take them longer. And again, this is one of those listen to your body things. If your body is telling you need more, you'll know. If you don't feel good when you start eating plant-based foods again, you probably need a little bit more natural probiotics or probiotics. There are some supplement probiotics that I have given to patients who've really had depletion of their gut flora. So it's not that in those patients, they really do. I do recommend an oral as well, and they will need extra. But the length of time, it's really dependent on your body.
Right. Thank you for that. So one last question, and that is can sauerkraut fermented?
I mean, I think that it's probably fermented. I think that if it's sauerkraut, it should be fermented. I don't get the canned one. I get the one in the bag that I don't know, maybe you may know better, or Melissa. I think it is.
I know one of the things we always say is look in the refrigerated section. The refrigerated section at your grocery store is where you're going to find most of the fermented with the live cultures in it, whether it's the kimchi, sauerkraut, miso, those type of, even your yogurts or that sort of thing. That's where you're going to find those, not on the canned goods shelf.
Yeah, most of the time. And another tip is to look at the ingredients. If it has vinegar in it, it's not going to have all of the microbes that you really want, not all the bacteria that you want. And so you really want to look for something that does not have vinegar in it.
So remember, vinegar is not fermenting. So vinegar makes you feel like you're getting like a pickle, but we're not fermenting.
Yes. That's right. So Mary says, she says, I am so overwhelmed. I guess baby steps. And I think that is very true. We got a lot of great information in today's workshop. It is awesome information. I'm actually going to have to watch it again because it was so good. And so I'm going to be doing that. But yes, definitely take baby steps. Start with the easiest step that you can do today and then slowly build up to it. It's not about being perfect right away. It's just about building those steps. Thank you so much, Dr. Aggarwal. Thank you, everybody, for being here today. If you want more information on Dr. Aggarwal's stuff, including her podcast, Amy's going to post up her email, her website one more time for you to go over there. And then remember that in your membership, we have a lot of resources on fiber foods, on plant foods, on protein, on carbohydrates, on pretty much everything else.
Yeah. Thank you so much.
Thank you so much for having me. It was such a pleasure. The only thing I would just like to say is to the person who said about they're overwhelmed, I think that is something that I actually hear a lot. People feel like they have to make all the changes in a day, and that's not how this is. This is a process. You spent your life being a certain way, and it's okay to sort of take time to go back or change. You know, I always tell people to honor the process, take your time, breathe. You're going to be okay. You're going to get better, sometimes a little bit and then a little bit more. And it's okay. And so sometimes that's why I like that chart where I say first start by eliminating your red meat, you know, by starting there. And then you can kind of go through those little squares one by one. The other thing is I do have a cookbook out. It's a very simple cookbook. So if you're a chef, you do not want that cookbook. So it's sort of like the basics of
we love simple.
Yeah.
We love simple.
I love simple. And so like, that's how I wrote it for the simple, but at the beginning there's a 6-week starter. And so, there's like a 6-week how to start, and so that might help anybody who's sort of feeling overwhelmed.
Excellent.
That's wonderful. Thank you for mentioning that.
Thank you so much. It was a pleasure to be here. So thank you and good luck to everybody. And don't worry, we're here. We're all on your team. We're all supporting you in your process to get better.
So true. We'll see y'all later. Bye.
Bye.